Hello and welcome back to A Better World. This is your host, Mitchell J. Rabin, and we're very glad that you're joining us again today. Today we are on location in Yarmouth, Maine, a very beautiful place, at Women to Women Health Center, where women from all over the world come and get treated for GYN problems, and they're treated in a very humane, very loving way, where the body is recognized as sacred, and therefore women from all over come for the medical assistance and medical support that they get here. We're here with Peggy Huddleston, who you saw last week, who is the author of this book, Prepare for Surgery, Heal Faster, psychotherapist, one-time student of divinity at Harvard Divinity School, and she's been running workshops around the world for over 25 years on the subject of mind-body techniques and what people can do to empower themselves to deal with their own health directly and get whatever medical assistance they may also need. So, Peggy, I want to welcome you to the show.
Thanks, Mitch.
It's great to have you back.
Wonderful to be here.
Good, good. Now, if you could just give a couple of introductory words, would you, about the work you've been doing here at Woman to Woman and the kind of benefits that people are getting?
Well, I was fortunate enough to have Dr. Christiane Northrup write the foreword to my book, Prepare for Surgery, Heal Faster.
Who's one of the co-founders of Woman to Woman.
And Dr. Northrup and the other doctors here have been using the book with patients who unfortunately have to have surgery. Their hope is that patients can avoid surgery, but for when they do, they need to be able to learn how to prepare for surgery. And the book guides a patient through 5 steps they can use, preparing them. They're all medically proven techniques, and they show a patient how to get very relaxed, and as a result, they heal much faster using much less pain medication.
Wonderful, wonderful. And the techniques are easy and simple, and anybody can learn them?
They're easy, they're simple, anyone can learn them. People can use the techniques if they only have an hour before surgery. There's one that will lessen the use of pain medication anywhere from 25 to 50% just by having some healing statements said as the patient goes under the anesthesia. It's better if they can use the book and the tape an hour, not an hour before surgery, but a week before surgery is ideal.
At least.
Or 2 weeks.
And it's also good for people who are not having surgery at all, who just want to gain a better sense of their own physical, mental relationship, and who have other sorts of problems that want to deal with it visualization-wise.
Yes.
Right?
Yes.
Okay. Very good. Well, we have the opportunity to speak with June, who has been using Peggy's techniques for quite some time and has had quite an extraordinary experience with them. So we're going to be bringing June on, and then Dr. Dixie Mills here at Woman to Woman, who's been doing some wonderful work with lots of women using these techniques and the other methods we kind of described, the attitude that Woman to Woman has toward women. So just stay tuned. Now we're sitting with June King, who has had an exceptional experience, and yet I should also say that many people all over the country have been having exceptional experiences, because these techniques that Peggy has written up in this book are for everybody. June has a particular story that we have loved to hear, so she's going to be sharing it with us now. Thanks for coming on the show, June.
Thank you, Mitch. It's a pleasure.
Good. Good. Will you just tell us what happened and why you were using the techniques in the first place and the story?
Well, I was diagnosed with breast cancer and made the choice to have breast surgery. And I've always been a person...
When did this happen?
About a year and a half ago,
Okay.
May of 1996. And I've always been sort of an intuitive person, and I wanted to have some kind of sense of calmness during my surgery. And I had gone to my plastic surgeon, who gave me the book and told me that it might help during my surgery. I then called to get the tape and got directly involved with Peggy Huddleston. Mm-hmm. And from there, everything just sort of happened. Did the program. I had 2 weeks to do it before my surgery, so I had a chance to really get involved in it.
Mm-hmm.
It helped out significantly in my surgery. I was able,
How so?
I was able to be very calm before surgery. Had no medication before surgery, nothing to calm me down. Mm-hmm. It helped me to focus. to take some control over my surgery. I met with my anesthesiologist, as the book recommends, and my surgeons.
So they knew what you were doing?
They knew what I was doing, yes.
And they were in favor of it?
Very much so,
Excellent.
yes. I had tapes.
See, things are changing.
I had tapes playing during my surgery. I had the physicians saying positive statements while I was under anesthesia, so that helped significantly.
Excellent.
I ended up having 6.5 hours of surgery with really no significant pain. I only had Tylenol for pain after my surgery. I was out of the hospital. I had a major mastectomy with breast reconstruction, and I was out of the hospital in 2.5 days. And
whereas typically you would have been there for how long?
I'm not sure what the typical time is personally. I just know for myself, I had a really remarkable recovery.
Sounds very brief.
I had no pain medication. They wanted to give me some, but I didn't really need it. I had some discomfort, but no actual pain. It was really amazing. It was very helpful for me. It continues to be helpful for me in my life. I use the tapes pretty much on a daily basis.
Really?
I find it very helpful.
So you've integrated it into your way of living?
Yes. It's very good for stress, for anxiety. I would highly recommend the program for anyone going through kind of surgery, day surgery, or anything longer than that. It's very helpful.
Excellent. Thank you so much. Is there anything else that you would want to tell the audience about your experience?
Just that I find that the calmer you are before surgery and the more focused plays a significant part in your recovery, I find. And this program really will help that.
Wonderful. Thanks so much, June.
Thank you
Really
for having me.
Great. Stay tuned. And now we're talking with Dr. Dixie Mills of Woman to Woman Health Center here in Yarmouth, who is a former instructor, faculty member at Harvard Medical School, worked with Dr. Herbert Benson in the Mind-Body Center there, and is now one of the doctors here at Woman to Woman, doing the work that I was referring to before, working with women and using Peggy Huddleston's techniques to great advantage for the patients that are here. So we're really very pleased to have you on the show.
Thanks, Mitch.
Yeah, sure.
Great to be here.
What brought you here in the first place? Let's just get a little background on Woman to Woman.
Well, I think I was attracted to their mission statement of empowering women to take responsibility for their own health and to join in a comrades with their physicians and healthcare providers.
You were also a board member of the American
Association
for Women Surgeons.
Right.
Wonderful.
It's a large group of women surgeons across the country.
Excellent.
That have actually, many of them used Peggy's book. We've had it advertised or written up in our newsletter, and I think she's had some publicity from that.
I'd imagine that women surgeons would be quite open and interested in these kinds of approaches. Is that so?
It is. It is.
I mean, more so than their male counterpart.
Well, let's not
in
get
general.
into gender differences, but I think that many women certainly feel some compassion with their patients, and especially as a breast surgeon, I feel some empathy with women having to have surgery.
Sure, sure. Oh, I believe even the male doctors have compassion too, but they may not be, in general, as open to the patient acting on his or her own behalf.
Well, I think some men want to take care of their patients and feel that if they just, do it for the patient, that's the best way. But I think that, in this, as we go into the new millennium, I think it's important that everyone be as informed as they want to be, and I think that that's what the book has really helped me as an adjuvant to, it takes some of the responsibility away from me. I can tell the patient, here's a book you can learn. It gives them suction too. They go home and read it, and they get really intense. They spend all night reading it and checking off. Some
get
people
turned on.
Yeah, some people get very obsessed by it and go through all the checklists. And
I see, right. It's also what you were suggesting before is that there's a co-responsibility, because certainly it should never have been all on the hands of a doctor anyway. That is also a misguided notion that took root, unfortunately. But yeah.
Most healing is self-healing, but we're physicians because we play some role in that.
Indeed. An important facilitating role oftentimes. Yeah, no question. So what kind of experiences, Dixie, have you seen among your patients who have been using these mind-body techniques?
Well, everything from particular June, who you interviewed before, was the most serene in the recovery room. I think everyone was thinking she was on some high drug or something, but she wasn't. She was just amazingly serene.
Her own mind.
And her family was there, and you could just see an aura of love all around her. When she went into the operating room, it was quite unique. I'll always remember that. And
so you were one of the surgeons in the room?
And I just yesterday did a patient who was incredibly nervous, but she had her Sony Walkman and the tape with her, and it was like this great comfort to her. And we did her healing statements, and I think I'll always remember. One of the healing statements is we say what they're going to be hungry for afterwards, and that they will do well afterwards. And she wanted to be hungry for chocolate and toast. So that's a unique
bread
combination.
and chocolate.
Right.
Not so uncommon.
Right. And I saw her this morning, and she was doing amazingly well. She said, "I don't have any pain. Should I?" So people really
Isn't
do
that
do
wonderful?
better.
Now, was the amount of anesthesia that she required less than usual, or did
Well,
you do the normal?
Because I don't give anesthesia, I can't really talk about that, and I think that that's somewhat the anesthesiologist just gives their usual dose. But I think post-op is where women really do remarkably better, having done the tapes and being prepared for what is in for them afterwards. They don't really need the pain medication, and they want to go home earlier.
So do you find that to be typical then of people who are using these techniques?
Definitely.
That they can be released earlier?
Yes, definitely.
With full medical support?
Right, definitely.
Do you think it's having any effect? I'm not sure it's measurable, but do you see any effect in what's going on in the operating room itself?
That's a hard question.
And that might be related to the state of mind that maybe you're in by looking at the patient before they even came in.
Well, there's been some work about suggestions about bleeding and how much, some patients do some visualization that they're not going to bleed, or some
excessively,
very sophisticated patients, right, they will bleed, but that they're not going to bleed excessively, right, and that they're going to clot well, and I think that it seems to work that way.
How do you make sense of this in your own...
It's the other dimension.
There we go. That was very simple and straightforward. How right you are, indeed. It's funny because it's just so a field, if you will, of your standard medical training. And so it's really very wonderful for someone in my shoes to see doctors like yourself who are embracing the reality of the other dimension or other dimensions, which are just that.
Right.
Just that.
I don't feel...
It's not heavily mystical or anything. It's just another level of reality that exerts its own power here.
Definitely.
What were we going to say?
Oh, that I'm curious about it. I don't feel threatened by it, so I'm just curious about it.
And you're seeing results accrue.
Right.
So,
but I don't have them in any double-blind study, and I'm not sure that we'll ever have that. But I just, personal basis, I see amazing results.
Through personal observation. That's wonderful. Well, thank you very much, Dr. Mills, for coming and chatting with us about this.
Sure.
It's really, and keep up the great work that you're doing here at this center. I'm very pleased to hear that women have a place to come where they're so comforted and supported in being women and going through whatever it is they feel they need to go through and have to go through.
Sure.
So, excellent.
Great.
Thanks so much.
Sure.
Now we are on location just north of Boston in Newburyport with Cheryl Richardson, who is a personal coach and has also been known across the country for the work she's doing, and recently was using Peggy's tapes in a situation that came up with her medically, and she's going to be sharing that with us right now. Welcome to the show.
Thank you. Thank you.
Good to have you.
Thank you.
So what is it that happened, and why was it that you were using Peggy's tapes?
Well, I had made a decision a couple months ago to have surgery, and had been trying to avoid it for 2 years because I was really scared, and scared of both just the physical procedure and being the loss of control, and also because when I was younger I had had a very traumatic experience as an 8-year-old girl in a hospital, and so I tried for 2 years everything I could do to avoid the surgery, and when it...
Quite successfully.
Yeah, exactly. And then when it finally just became clear that surgery was going to have to happen, I had heard about Peggy and gave her a call and went to see her, and she was very helpful and very comforting, and I got her tape and read the book, and I'm a very responsible patient, so I followed it to the letter, and used her tape 2 to 3 times a day for about 3 weeks prior to surgery. And I found probably within 3 or 4 days that I started to feel incredibly calm about the decision. And as I read the book and felt more in charge of the process and began, speaking with the anesthesiologist and gathering together all the information that I needed and the support that I needed, I started to feel much more calmer than I ever thought I would. And so when the day that surgery came around, the day, even doing the pre-screening, I should say, going into the hospital, even getting near the hospital, used to give me the creeps. I mean, I would just be really uncomfortable. And when...
It's often anxiety producing.
Right, very much so. And I noticed even the first time when I went for pre-screening that I was just much more relaxed and just in a much better place. And
so it was sort of like the use of the tapes was kind of just carrying over and carrying through.
Yeah, it was also, it also taught me to put myself into a relaxed state when I was most frightened, and that's what I was able to do.
No matter where you'd be.
That's right. In the hospital, driving up to the hospital was a test. And so by the time I got to pre-op, being in the pre-op room, being well prepared, having both a Reiki practitioner and having asked lots of people to imagine me wrapped in a pink blanket of love, I was just amazed, as were my doctor and my husband and my parents who were also there, how incredibly peaceful I felt and how overwhelmed with love I felt. As a matter of fact, at one point I remember saying to my husband, I started to cry, and my husband said, "Are you okay?" He was really, thought I was getting scared, and I said, "I'm so moved, I'm so overwhelmed with love right now that I just can't believe what a beautiful experience this is," and ended up not needing any medication going into the operating room at all to relax me. I was so relaxed, everyone wanted to know what I was taking. They wanted, the anesthesiologist couldn't believe it. Right, exactly.
Called me in the morning.
And a lot of love being sent my way. So I went into the operating room fully conscious, very relaxed, able to talk to the people who were going to be operating on me beforehand, and came out of surgery feeling almost no pain, and had a recovery time predicted of about 6 weeks. I did end up having major surgery, and instead was up and around and driving at 3 weeks' time afterwards.
So that time was cut in half.
It was cut in half. And I continued to use the tapes after surgery as well, and it really helped me to really stay in a relaxed state, and I think that really contributed to the healing of my body. And most importantly, it also healed that traumatic event from when I was 8 years old. Yeah, I mean, that was a major accomplishment that had been with me all my life and had been tormenting me in one way or another, and that stopped.
That's fantastic.
Yeah.
Good for you.
Yeah, thank you. It was really great.
God. So are they still active in your life too? I mean, are you still using the tapes now? I mean,
yes.
It's after, but...
what I found is the tapes are just a great way to continuously keep myself centered and on track and just peaceful. It just helps me to go through my life, in just a much more centered way. It's a great way to stay in the flow.
Sure, absolutely. Yeah. Well, thank you very much.
You're welcome. Thank you.
On. Absolutely. Peggy, these have been just glowing reports, one after the other, from doctors from Harvard Medical School all the way to personal coaches and therapists and just people from all walks of life who are really getting tremendous benefit from your work.
Yeah, it's very exciting. And it's not...
This must feel really good to be both helping so many people and to think that what you're doing is being integrated into the fabric of the standard medical world.
Yeah, what I find so wonderful is that people just find the book in a bookstore. They say it sort of kind of falls off the shelf into their hands. They go home, start reading it. And they say as they read it, they get calmer and calmer as they put the steps into place. The thing that I found most rewarding, and I think Cheryl's an example of that, and June, is that many people said that as they use that relaxation healing tape 2 times a day for about a week or so, or 2 weeks, they'll call my office and they'll say what Cheryl said, sort of what she said, but people often will call and say, I feel more peaceful than I've ever felt in my entire life. And I hear these messages at my office, and I'm so touched by it, because they encounter a level of peace that's really connecting with their own soul. And as they anchor to that before surgery, they then are very calm, and as a result they create the biochemistry of healing, so they heal much faster. But then it becomes a peace that they know is always there deep within them, and they begin using throughout the rest of their lives. And that's what I find most moving.
Absolutely. It's like you are playing this role of facilitating people getting closest to their own deepest self. That the surgery is almost like an excuse for you to intervene into their lives at that moment in time, get them more in touch with who they are, which is really their own process. But you came at a very critical moment and said, hello, remember your divinity?
It's very beautiful, because people are so, because of the fear, actually surgery is the time we come closest to death. So there's so much fear around surgery, and it's very rational fear. I don't think it's irrational, it's very rational, because often before people are having surgery, the stress of surgery will bring up old emotional traumas. Whatever unfinished business is there, that starts surfacing, and people don't realize that, and so as they discover that what that other process is, and stuff that needs to get processed emotionally, not only does that get healed before surgery, but they connect with that deep peace.
Absolutely. And God knows that stuff that was unprocessed for so many years may have been leading them to the edge of surgery in the very first place. So it's a whole cleaning and clearing that you're doing. It's a whole healing that's being facilitated that needs to happen at one time or another anyway. So.
What I find interesting, Mitch, is when I talk to different people, what they say. I talk to surgeons, and I watch them hear what they'll say, and I've been so surprised. I thought they'd say they're so glad their patients are more relaxed and that their patients heal faster, but instead what they say is they're glad their patients are happier because they make less phone calls to their office. And I found it amusing, because from their point of view, they say, we have a patient who's just much easier to do surgery on. And what patients say is completely different. They say, oh, I could take that anxiety and actually feel peaceful, and I healed so much faster, I left the hospital a day early. And I could get back to, like what Cheryl said, it only took me 3 weeks of my life. It's your life you're talking about.
That's right.
To go through recovery instead of the 6 weeks.
Yeah.
Cheryl's writing a book that will be out next fall, and so she needed that time.
Sure.
She was concerned about, when will I get back to my writing?
Sure.
But what insurance companies say is, it's saving us a day in the hospital, and it's usually about $1,000 that it's saving the insurers.
Oh God, sure. It's incredible. So you've heard of side effects? Well, these are positive side effects. So doctors need to know those are possible too. Would you walk our audience through the 5 steps?
Yes,
so
I'll
they
be
could
glad
have
to.
it for, if they don't have the book, they could make use of what you have to say.
Good. If you're having surgery tomorrow, or if you're having surgery in a week or a month, here are 5 steps you can use.
Or if you're not going to have surgery at all.
That's Mitch's hope, and mine, that you can use this to avoid surgery. The first step is to use the relaxation healing tape. You can get one from my office, and I'll give an 800 number explaining where you can get it. This will put you in a very deep state of relaxation and ask you to think of the person or a pet who's easiest to love. And as you feel your love for that person, research shows that will actually enhance your immune function. So for the week or 2 you have while you're preparing for surgery, your immune system will be getting stronger and stronger, and that's what your really quick healing after surgery. The second, and that tape you'll want to use probably twice a day, sometimes 3 times a day before surgery. The second step is taking any worries or fears and turning them into positive healing imagery. The tape will say, think of your first end result. For example, a woman having hip surgery. She imagined coming back into her hospital room and saying to her 8 kids who are all going to be there in the room, I'm feeling really comfortable. And she imagined them saying to her, Ma, you look great. Her second end result was leaving the rehab, walking, with all of her kids around her saying, Ma, look how well you're walking. The third one was she'd always wanted to go to Las Vegas. She said, if my hip's fine, it means I'll be in Las Vegas on a trip with a friend. So as she imagined that, every time she'd have a worry, which can happen 100 times a day, she'd imagine that scene of walking out of the rehab place with her kids saying, Ma, look how well you're walking. That woman left rehab a week early, and earlier when she was in the hospital, she used 50% less pain medication because of the healing statements. So that's the second step. The third step is my favorite one, of asking the people who love you to surround you in a blanket of love. Cheryl, I think, used a pink blanket. Some people make it purple, and you'll feel this delicious love around you. The fourth is asking healing statements to be said by your surgeon. They're in the book, and they reduce your use of pain medication 23 to 50%. The last one to meet your anesthesiologist. So there you have it. The book will guide you through how to put all those into play and how to use it at home.
Wonderful, wonderful.
Should I give them the 800 number?
Yes.
So they can, if you don't have a bookstore near you, you want it right away. We FedEx books out all the time. 1-800-726.
If you want to get more information about Peggy's work, you can call and find out what she has at
800-726-4173.
Why don't you say it again?
800-726-4173.
Wonderful. And using the tapes also helps memory, doesn't it?
Yes, I hope so.
I think you're really doing an excellent, excellent service for people, Peggy.
Oh, thank you, Mitch.
You've taken something that is probably the most life-threatening feeling when people imagine being faced with a knife. Usually, in other contexts, we run the other way. Here's one where we're saying, take me. So you're taking such a delicate moment in somebody's life and really helping to recondition, reshape the entire experience so it really is positive. God forbid people should need surgery. You are making it a humane, loving, therapeutic experience rather than one to run from. And I think that's a really fine, high service.
Thank you, Mitch.
Absolutely. Thank you. So, you have the numbers if you want to get in touch with Peggy and learn more about her work and to get information about the video and audio tape and book, which are around everywhere, all over, and are becoming more and more available at hospitals and medical clinics across the world. So, I want to thank you all for joining us and watching these episodes as we have explored this whole very important subject of the role of mind-body techniques that are entering the medical establishment. This is Mitchell J. Rabin for A Better World. Thanks so much for joining us. My number is 212-420-0800. Please feel free to give a call. I love hearing your thoughts and feelings. Give a call anytime. And I look forward to seeing you all next week.